Narrative Therapy, Chapter 1, Shifting Paradigms from Systems to Stories. This book describes how we, two particular therapists within a community of therapists, are applying two metaphors, quote-unquote narrative and quote-unquote social construction, to organize our clinical work. Using the narrative metaphor leads us to think about people's lives as stories and to work with them to experience their life stories in ways that are meaningful and fulfilling. Using the metaphor of social construction leads us to consider the ways in which every person's social, interpersonal reality has been constructed through interactions with other human beings and human institutions, and to focus on the influence of social realities on the meaning of people's lives. A guiding metaphor, such as narrative, is no small matter. The metaphors through which we organize our work have a powerful influence on both what we perceive and what we do. Paul Rosenblatt, 1994, has written a whole book explicating this phenomenon in the field of family therapy. He discusses such metaphors as family as entity, family as system, communication, and structure. In his discussion, he describes not only what each metaphor highlights, but also what it obscures when used to guide one's thinking and perceptions. For instance, in using structure as a guiding metaphor, we tend to think of families as rigid, geometric arrangements of people. Such thinking has led to the development of useful ideas like triangulation and boundaries. Therapists using structure as a guiding metaphor might concern themselves with rearranging, strengthening, or loosening existing structures. They would tend to approach the problems and their resolution in some of the ways that carpenters, architects, or sculptors would. This can make for very clear, teachable, and effective approaches to therapy. However, the structure metaphor can at times invite us to pay too little attention to the ever-shifting, ever-changing aspects of family relationships. It can freeze our perceptions in time and oversimplify complex interactions. It can invite us to treat people as objects, thus dehumanizing the therapeutic process. There are pluses and minuses for all organizing metaphors. Because the metaphors that we use influence what we look, listen, and feel for